Now, in doing this one, you're going to have to bear with me. This is going to strain every sinew in terms of your staying power, because this child cries most of the way through the interview. So if you're expecting a comfortable, stress-free time, you can forget it. There's only one child, but it makes enough noise for two, I think.
And whatnot, but September was the first bout of the bronchopneumonia, and she was taken into hospital. Right, I can't listen. The doctor can't hear me when you go on like this.
Did it start with a simple cold that she reacted badly to?
It didn't seem to. It just came right out of the blue. She started coughing like this, and then we noticed on the Saturday night the breathing became ever so rapid, and the emergency doctor came out and she was taken to hospital, and we thought it was asthma to begin with, and the x-ray showed that it was a very bad chest infection, and the effect was bronchopneumonia, which was a complete shock because she hadn't been dreadfully unwell, nothing that I could have said, oh, she really is.
Did they find the pneumococcus? Did they find that there's a pneumococcal infection?
This is not long before Christmas last year. She's been her first bout of bronchopneumonia was in September of 1994, and you can see that she's been in and out of hospital. This case is starting to unfold that she has never been well since. So there's your first pointer. Any observations on the child at this point in time? Anybody like to make some kind of, get the ball rolling in terms of observations, what we see, what we feel about the child, even your own responses internally about, you know, what's going on?
Well, she picks her nose to start.
Mm-hmm.
Very whingy.
Very whingy.
And irritating.
Very irritating. And you've got to be prepared to stand this for the next little while while we run this case, because
irritating child rather than I can feel the breathing better.
No, irritating and irritable and irritating. Yes. We'll go on a bit further and we'll see what else we can pick up.
You never
Was it one side or both sides?
It was the left-hand side.
So it's probably a pneumococcal infection.
Lucy, come on. No.
Since then, she had... We'll get you a book. Get her a book out, Mum.
What's in the office?
She's been living on antibiotics and calcium. Last week, since she came out of hospital, there's been umpteen emergency doctors out to see her. She was well for about a week, and then it all starts again, and it's a different type of antibiotic. You just go from one bout of this to the next, and she coughs constantly, and she can't sleep, and generally she's just...
Okay, so we've got a little bit more. Left-sided bronchopneumonia. We don't have the organism. What do you think about that little spell in terms of contrast between that and the first little spell we saw in terms of the child's behaviour?
She was more comfortable, child.
Well, she was making less noise, wasn't she? And this is one of the things we'll see in the course of the interview. She goes up and she goes down, and she goes up and she goes down, and she gets excitable and irritable and difficult, and there'll be another little pattern of quietude and so on. And
I find, looking at the mother and looking at her, there's a striking difference in the facial appearance. The mother has sort of got a certain tinge of redness or brownness to her face, whereas this child is extremely white.
Yes. Father is sitting over, just round out of view of the camera, and he's relatively light colour in his skin tone.
Unwell, and obviously her system is run down. She can't be bothered. She's getting very fractious, and
quite red in the face and quite flushed.
Not usually.
Not usually.
Only when she's crying.
She's quite pale. She's pale skinned.
Right. How high have her fevers been? Have they been dramatic and high, or have they been relatively sort of crumbly and low?
They haven't been particularly high, I wouldn't have said.
She's been quite catarrh.
Yes, terrible.
cough, what kind of cough is that, and what remedies might you start to go through your mind when you hear a cough like that? Sorry? Ipecac. What is there so far that is against Ipecac as a remedy for that cough? She's coughed twice so far.
No sputum, dry cough.
Yeah, there's nothing much appearing. There's nothing appearing. But you can see Mum's coming up with the tissue and an expectation there's something might come. But
Sounds a rattling.
yes, yeah. So what other remedies for really moist, rattly coughs of that nature? Yeah? Pulsatilla, maybe? Spongia. Drosera? What do you think about the length of the bouts for Drosera?
Yes, well, at night, more at night, and more long, yes.
Yeah. Yeah, you don't get just 2 or 3 coughs and that. You'll get a long cough. And what else about the cough would you expect for Drosera? How would the coughing bout end?
But really not in town. It's a big cough.
You might well get drooling.
More costly.
Yeah. Do you think this is whooping cough, looking at the child?
Sorry?
Do you think this is whooping cough, looking at the child? What do you think, why do you think it might not be whooping cough?
No, because it's so long. And,
Well, whooping cough can last for many, many weeks, and after the initial infection, many, many weeks.
yes, you're right.
Um,
But whooping cough, Drosera whooping cough must be more in the night, not in the day.
well, we'll come to that. As the thing unfolds, you'll see that in fact she's very bad at night. But I would say that, particularly in this phase, she's not particularly toxic looking, is she? And we don't see, for somebody who's had who might have had whooping cough for as many as 3 months in September, we don't see any subconjunctival hemorrhage or anything else that suggests she's been really exposed to bad bouts. And nor in a whooping cough, when she cried, you'd hear a real hoarseness there. Anybody who's been coughing on their vocal cords for that length of time, for long bouts, you wouldn't get this cry. There would be a rough edge to it, much rougher than we've got here with the whooping cough. So I think that, we can more or less, through all these different things, exclude whooping cough, probably.
But it becomes more suitable because it seems to me she tries to, not to vomit, but close to vomit after
Yeah.
cough. It's more
Possibly. So we've got what we've got. We've got pulsatilla. We've got antart. Did we say? We've got ipecac, possibly Drosera. Anything else that we might think of? Any other remedies? Cough remedies? Perhaps carboveg, yes. Perhaps a considerable number. We'll go on to the modalities. Mum will tell us a bit more about the modalities, and we'll start to be able to home down on possibilities and evaluate the place of these remedies.
Come on now. Now, come on. There's nothing wrong with your chest. You're all right.
What's coming up on the cough?
Phlegm.
What's it like?
Lumpy. There's bits of kind of lumpy yellowy, and the rest is clear.
Is it fluent? Is it moving? Or is it sticking?
It's just sticking.
Has she got a good time of the day and a bad time of the day?
Yes, evenings, bedtimes.
So again, it's demonstrating this alternating state again, a period of quiet, then a period of real agitation, then we'll probably get a lull of another period of quietude and so on. Any other observations you want to make at this time?
Sometimes she protruding her tongue as a laxative. It's one of
Looks cyanotic to me.
She isn't actually cyanotic. That's probably the coloration in the video. It's not all that good quality a copy. She isn't actually cyanotic. She is quite pale. The background is pale, but every time she cries, there's a flush appears in the cheeks. So there is, that component to it. Is there anything that might support lachesis? Is there anything else in the case that you feel might support lachesis?
What support?
The support, like I said, out of her general being and out of the history you've heard so far.
So her behavior, she don't want to be touched as an attention.
She's sitting on her mother's knee.
Yes, but it's not the defense for her, and she tried to cry. But this behavior of waving, you told, and this protruding of tongues with the washing of her lips, is the feature of behavior, unconscious behavior.
Okay, well, it's an interesting thought. We'll keep it in mind and see what else transpires. We have to consider the other things that would be there if laxus was there.
Just impossible.
Would that be because when she's lying down, she's less likely to cough over her?
It's part of that. It's part of the biorhythm that she's got herself into.
Oh, Lucy, come on, here.
Normally, even when she's well, she's changeable. She's delicate. No, I would, if at all possible, I'd rather she was here, if that's all right.
Since Wednesday night, she has been, when she was taken in again to have another x-ray, she's been impossible. She's been very prone to tantrums, which she isn't normally. She's actually a very good child when she's on a good run. She's a smart wee thing. I mean, she knows exactly what's going on round about her.
Is she changeable? I mean, is she...
So we're coming back into another period of agitation again, and she's been out, she's been down, but she's coming back up again.
Did you know what she said when she was crying and talking? And when what was understood?
She was basically objecting to interference, you know. She was basically objecting to her father making motions or offering her toys or something else. This is the problem that you can't quite see, but that will be repeated. It's just about to come up again. That same issue is about to come up again, and you'll see it in much clearer detail.
Why did her mother say she was worse? So sometimes the accents are a little
Yes, definitely she has a very bad time in the evening, going into night, you know. She's very bad in the evening. And what did she say about the sputum, the nature of the sputum?
She keeps some sputum on the head.
She said it was lumpy.
Yeah, she says it's lumpy and sticky, got yellow sputum, left-sided. Any remedies that you for chests that might sort of start to come out? Sorry? Kelabic. This sputum is moving, and what is the essence of Kelabic sputum? It's stringy and it's gelatinous and it comes out in great big elastic bands. It's not.
Sometimes lumps without.
Yes, sometimes. What about Kelabic in terms of the overall pattern, the overall feeling for the case? Is there anything else that would give you Kelabic in the case? Is there anything that would suggest you go down the line for Kelabic in terms of modalities or anything else?
No, Kelabic has a worse time in the morning, not in the evening, maybe first. And the main one.
So we have a possibility, we've got a local symptom that might correspond to Kelabic, but we haven't got anything else to support the remedy. Okay. Any other observations? And we'll move on a bit further.
The remedy is a sulfur.
Yeah.
So long-lasting condition maybe sulfur too.
Does she look like a sulfur?
Yeah. It's a pathological modalities.
Yeah.
And left-sided condition, especially the lower part of the lung, left lung.
In unwell sulfurs, what else might you have there? An unwell sulfur would have probably other pathology and other features and other physiological upsets. Well, we've got no cutaneous signs really, and we've got no bowel symptoms at the moment that might lead us forward. We have no sulfur typology in terms of the way she looks. Is there any typological features that you think that she might correspond to? In typological terms, any remedies that you feel that she might correspond to? Think of her as being well for a moment or two. Pulsatilla.
Clingy and she's sort of fair.
Yeah, she's clingy and she's fair.
But she, as a pulsatilla, must be more calm during the sitting on the mother's knees. bacteria more thinner than bacteria.
I think that that is a point. In general terms, yes, you would expect pulsatilla to be looking for the comfort and be clinging into mother and so on, and not fighting as much. But there are some, I mean, there are other, in different, you must remember that the stereotype you get of a remedy alters depending on the disease state that runs through that remedy, and the kind of constitutional picture you have, a constitutional type, is never laid down in stone, and it changes according to the dynamics of an illness. Illness is dynamic, and therefore the constitutional leanings that a case may have will alter according to the pathological events that are going on underneath. So, just a point to remember. Anybody else any other things to say, and we'll move on a bit?
Is she?
Yes.
Yeah.
She can go from being very happy to being quite moody and abrupt with me.
Right. Even when she's relatively well.
Well, she has her moments, but then I just take that as going through the sort of 2 stage and going to nursery and developing a wee personality.
Does she want warmth all the time, or is she complaining of being too hot, or what?
She complains of her hands being cold.
Does she breathe easily or not?
No, not often, no.
She's not having
The child had quite a lot of ear infections at this age, but she has since grown out of it.
Is she being sick?
She was. She hasn't been sick since she was put on the antibiotic.
Right, but she had been before.
She had been, yes.
What about her stools?
Normal, I would say.
They've managed to stay normal in spite of the antibiotics, have they?
Yes.
Is there a family history of allergy?
I'll tell you what, if you don't cry, stop crying, take your leave.
Look. No. Okay. Right, let's just sit for a minute. Look. Just.
What about gland?
So what was the remedy? What was the remedy before she had the antibiotics? What was the acute remedy at that point, do you think? For the very first stage of this particular chest infection, with this girl with this cough being sick at the end of each bout. It probably was ipecac, wasn't it? We've passed that stage now, but if we had seen her before the antibiotics, then, and we'd placed in that point in time an acute remedy, probably would have been ipecac, I feel. Although, what do you feel? No?
Just find out some coccus cacti too.
Coccus cacti. What about the vomiting of coccus cacti? When would it be most likely to be pronounced?
That's what came at the end of the coughing bout.
It does, but there's a particular time modality to coccus cacti as well. Most particularly, very first thing in the morning on awakening. So this child is worse in the evening. And the picture, we've now got a few modalities. We've got some sputum, we've got her nature, we've got her typology. We've seen that there's probably been a missed opportunity for an acute prescription because we're too late. So we've got to start to decide now on the management, to start to formulate our ideas. We'll finish this first interview, we'll have a look at the repertory, and then we'll decide on the management of the case.
Sorry, I missed some because
Yeah.
I didn't understand everything. What about another case about the cough? I noticed that she became cough during the deep breathing as phosphorus or caustic.
Yeah.
What about lay position, sitting position?
When she lies down, it's worse.
During the she became
Lying down, she's worse. She becomes, respiration becomes a bit difficult when she's worse, and she starts to wheeze. And
so she has to stand up and sit down.
yeah, well, sitting, she's better sitting. But conversely, I mean, the modality that is actually explained to us is that she's worse on lying.
What about the outdoors or the indoors?
Sorry?
On the street and in the room, the cough.
We don't have that as a modality. I don't have that information. you on a little?
She has sore throat. Doctors just said not to, and I don't think you should touch her, Lan. She's not.
I think it's probably best just if we work through it just now, and I can see her. We'll be finished in a few minutes, and I'll be ready to prescribe something for her.
There, you're all right.
What are her teeth like?
She actually tells me that her teeth are sore. They've all come through without too much bother. But she said to me today, my teeth are sore. And I think most of her teeth are through. She says that from time to time. Right? Okay.
What do you do with it? In there? Do you want another book now? Daddy, look at the book.
What about her tongue? Has her tongue been discoloured at all?
Did you hear that over the wailing and the sound? I asked her what the child's teeth are like. You know. Again, I'm looking at the background. I'm actually thinking of constitutional types and the dentition of constitutional types. I'm not expecting some kind of leader on the case, but the child is complaining of pain in the teeth. Now, all her teeth have come through. Her dentition is complete, but she's actually stated that her teeth are sore to her mother. Okay, so it's interesting. So, with this general behaviour and sore teeth, what kind of remedies might you be thinking of? Sorry? Chamomilla, yeah. It might well be. So it's another remedy to consider here in this case.
She hasn't had any breakouts?
No.
Has there been any rashes at all?
None that I could see.
When she's unwell at night, and she's... What do you do? I mean, do you find lifting her help?
Editing there. The position is that normally this girl is comforted by her books. Her books are her stories, and she sits and she can be comforted by her books, and her parents can normally open a book and divert her attention into the book and sit and read to her and calm her. The books at the moment are being thrown back at the parents. Again, that's a highly irritable state, and this is not in character with this child in her well condition.
Helps or that
I don't like to I usually just go in and try to settle her. She normally takes a sip of water, and she has a pile of books that she just likes to know they're there, and she's quite happy.
Is she thirsty with this, or isn't she?
No, she's not been drinking a great deal.
Would you say she's less thirsty than you'd actually expect?
Yes. Just very wheezy with it as well.
Right. And it tends to be worse when she's lying on her back.
Yes.
Dread, is it tend to be worse on one side than the other? Do you notice any asymmetry in it, or is it just all over?
It's one which is
Excited. She's not usually as red as
usually
this.
she is quite pale.
Okay, we've probably got all the information. We've got to decide on a remedy for this child. The child is clearly unwell. She's had multiple antibiotics, and she's still in this kind of condition. She's still got this moist cough, there's catarrh coming up, she has not really recovered from her pneumonia, she's completely draining her parents' energies away, she is impossible, and a case like this, which is partially treated, will go on grumbling like this for weeks and weeks and weeks. In our professional lifetime, we'll see so many children which are half treated, who've been suppressed with Calpol, who've been given multiple antibiotics, and still they've got sore ears, or still they've got chests, or still they've got recurrent upper respiratory tract infections. And this is one of the cases which is our bread and butter as homeopaths. So we've got to do it well, we've got to get it right, we've got to keep the patient better, we've got to exercise our acute prescribing. So how do we do it? Suggestions. And how do we solve this case before it sends us mad?
I prefer laxative because she became worse in the beginning. She tried the behavior of the tongue. I think that it's very suitable with laxative. Her mood is very changeable, the way condition. Her negative attention to father and mother, and sometimes he tried to hit mother. It's not chamomile, because chamomile can be calm for a short time, economic book and so on, but she refused it at all. It's more character of laxative.
Does anybody else agree with that?
I am thinking to give her chamomile first, and probably we have some realize about some symptom, but it's probably not her constitutional remedy. But we can clear up the case,
yes.
Chamomile, and then try with the constitutional remedy, probably also the local camp,
Right.
this kind of family constitution.
Right. Anybody else got any other ideas, and we can discuss these ones? What about lachesis who are physically unwell? I mean, when you get an unwell lachesis who's got physical pathology, not just reactional pathology, I'm not talking about a woman who's basically physiologically unwell and who's got sharp mood swings and who's got vasomotor flushing and so on. What about lachesis pathology? And this child is pathological. She's got left-sided chest changes and her x-rays are still bad. What, for example, would you see in the sputum, or what are you likely to see in the sputum of a lachesis case who's coughing up sputum? Streaks of blood. Yeah. Yeah, and for a respiratory lachesis case, I mean, lachesis is a very, very toxic substance. What about the coloration of the child? Some essence of lachesis which I think you would need to see in the coloration of the child somewhere, particularly in a respiratory case. I think you need to see some blueness somewhere, blueness of the lips or something. Lachesis is a very toxic material, and for a child to be lachesis, I don't know, I don't see very many lachesis children. I don't know if you do, but I don't see many lachesis.
Captain Coulter, right, that for lachesis children, well, they can be only one feature. The protruding of the tongue and the behavior according to another children. They can hit and after that they calm.
Yeah. This child isn't really hitting. She is saying no, 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 no. She's reacting all the time, but she's not hitting her mother. She's not hitting her mother.
When she tried mother to calm her, she became not hitting this.
Yeah. What happened was mother took the zip down, and the child didn't like it and zipped the thing up. I want this zip up.
After that, she became to undress it, especially on the neck.
The zip went up, it didn't go down. The child wanted the zip up. Is this a lachesis symptom? No. The entire essence, all the signals you get of this is not lachesis. Lachesis would definitely not want to be wrapped. They would certainly not want to be held tight. They would certainly, if the zip had to go anywhere, it would certainly be going down. If there was going to be anything in terms of the coloration, there would probably be, particularly in a respiratory case, some cyanosis, and the sputum that came up would probably be blood-streaked, I think. If this was, let's say, a constitutional picture, and we're talking about a child who's hitting other children in the playground, and where the disturbance is primarily at a psychological level, then I would say possibly lachesis, possibly magacarb, possibly tuberculinum, possibly anacardium, so on. If this was essentially a mental problem, and she was displaying the mental features with some kind of keynote, then fair enough. But this case is pathological. We're seeing this in the acute or subacute phase, and that means the acute or subacute symptoms have got to be in keeping with the remedy you choose, or else you will not get the response you look for. And if you give this child laxatives, you may well make her worse, particularly if you gave it in a high potency. I think you're dancing on thin ice, I think. So, other suggestions?
Does the child produce sputum?
Yes, the child is producing yellowish, thick sputum, yeah. Not offensive. It's described as relatively profuse, with yellowish lumps in it. And she's got this moist, rattly cough, which you think is just about to end up with vomiters. She's basically pale. She's got a low-grade fever. She's not having high peaks. It's not like a belladonna picture. The cough isn't an aconitum cough. It hasn't got that dry, hard feeling, and we don't have the weather modalities for aconitum. So we're not dealing with that. There's a suggestion of antimony tartaricum. What about silica? There are some leaders for silica that you might want to explore, particularly the chronicity of the case, the fact that it's an infective case and the chronicity of the case. But what about the fact is that this represents an acute remedy, and is silica usually an acute remedy? No, it isn't. It's not really an acute, although I could be corrected on the acute indications for silica, but
what's her sweating pattern?
It's relatively dry. She's not sweating much, and so it's silica.
Is she thirsty at all?
She is generally thirstless. She's drinking less than you would expect. Yeah, Kaylee self, possible. What about the epicenter of fevers for Kaylee self? When are the fevers for Kaylee self worst? Kaylee self fevers are definitely overnight. They become periodically fevered, and the periodicity of Kaylee self fevers are quite clearly marked. There's quite a clear periodicity. I can't remember what time it is at night. She's worse in the evening. She's worse in the evening. Definitely worse in the evening. Do you want us to look at, shall we repertorise a bit, and I'll take in some rubrics and things?
What about pulsatilla? So the pulsatilla is the next one.
Yeah, what about pulsatilla?
Yellow thick discharge. She thirstless.
Yeah.
Yes.
All right. Okay.
It's a bit harsh for pulsatilla.
It is a bit, isn't it?
Yeah.
Yeah. But what is the sputum in keeping with pulsatilla? Yeah, the sputum is in keeping with pulsatilla. What about her mental state, though? Is that in keeping with pulsatilla? Yeah, you. Right. Okay. Now here we come down to a choice, because we've got two indicated remedies here. I don't know if it's starting to come clear. We have the changeability of the pulsatilla. Even the background of her condition is changeable. And in the course of the interview, she's alternating between this highly agitated state and a period of quietude, and highly agitated and period of quietude again. We've got the bland, lumpy sputum in keeping with the pulsatilla, and the moistness of the cough in keeping. She's worse than lying, which is in keeping with pulsatilla.
She's thirstless.
She's thirstless, which is in keeping with pulsatilla.
She doesn't like sympathy.
Yeah, and so we've got this dichotomy. We've got a difference between her mentals and the physical indications for the remedy. But this is where we've got to understand what acute prescribing really is, because we've got to treat this child and we've got to prioritise the management of the child. And so what do you think we should do, this child? Maybe we should look at the materia medica of the chest symptoms of pulsatilla.
It does want sympathy. She's clinging to the mother.
She is a bit, isn't she? She is clinging.
Except that this child doesn't want sympathy either.
Yeah.
Now and again, they tend to get a bit of whinginess of a pulsatilla could account for that. But she's still clinging to the mother, even
Yeah.
when she's whinging.
Yes.
And the one father decided to help mother.
Perhaps the petulance of a pulsatilla child. She's still clinging to somebody, though. She's not pulling herself and sitting on her own.
No, she isn't. I mean, she's not sitting in a corner with her face turned away and saying, leave me alone, don't touch me, don't touch me. What remedy with a cough like this would just simply not bear to be touched, particularly if it's been a moist autumn and the child has become unwell with a fever and a chest infection and a bad cough with sputum? What remedy? Just would not be touched. Kilakar, possibly. I'm thinking of another one. Hepa self. Hepa self, useful, very useful respiratory remedies, Hepa self. But you wouldn't have the Hepa self sitting on the knee, you know, like this.
And I would have thought of chamomilla for this girl for that reason. She's holding on to the mother far more, I would have thought, than a chamomilla child.
Right. Okay. But you see, she's got pain in the teeth. And how many...
I can see
Yeah.
bits of that, but...
Yeah. So, what are we going to do? We have these two remedies, and what we have to prioritise the case, and we've got to treat the case according to the priorities and our understanding of what the remedy will actually do. So, what do we do with this case?
You're suggesting to repertorize more the physical condition.
Yes, I am. That is what I'm suggesting. I'm saying that in this case, what is important, the fact that she's irritable and will not bear to be touched, or the fact that she's got a chest infection. You know? Everything we see, everything that is immediately hitting us in the face, and the way she's crying, and she's got pain in the teeth, and she just can't bear to be interfered with, or she's slapping people off, and she's highly irritable, and yet she's got this need for being close. I mean, the basic feeling of the case could well be chamomilla. But what should the remedy be in a child with these features who's got a chest infection and who's got sputum coming up? Will chamomilla reduce her chest infection? No, I wouldn't thought so. It's got hardly any chest symptoms. No, I mean, no. So is chamomilla the first remedy for this child? No. Pulsatilla. Pulsatilla is the first remedy for the child. And everything else, the pathological symptoms, the modalities of sitting and lying, the thirstlessness, the worse in the twilight hours, everything indicates the typology of the child. Yeah?
Symptoms come suddenly and go slowly.
Yes. Yeah, changeability. Everything about it. The background of the case is changeability, and her actions are changeable and fluctuating in the course of the day. In this case, if we ignore all that evidence for pulsatilla, even though we don't necessarily think of pulsatilla as being one of the most important chest pneumonia remedies, if we ignore all the symptomatologies and the physical modalities, I think we're not doing any... Yeah.
First one, pulsatilla more right-sided than left.
Is it pulsatilla more right-sided than left?
It seems to be more right.
I'm very skeptical.
I think...
And the second more important, you talked about the changeability of her behavior, but it seems to me she is very independent, and pulsatilla is very dependent on the environment, and this change in your mood, in your behavior, must be dependent on your behavior of the father, your...
But she's very independent. Do you not think she's reacting to her environment? The immediate environment?
I have no this.
I think yes, because when the mother is speaking good things about her, the loudliness is coming down.
Yeah, I agree. Pulsatillas are changeable and they do respond very much to their environment.
So I think that she depends. She show her behavior according to the environment.
Yeah.
Because I don't think
the point is here that the mentals of this case are not pulsatilla. In a way, the mentals are not pulsatilla.
No, pulsatilla is a weeping.
Yes, where are the tears? You know, where are the tears. We're not seeing them flowing out of this girl's face, and we're not seeing the natural inclination toward symphony, closeness and clinginess.
I can disagree with you there.
Well,
I think this kid is clinging to the mother. And when she turned to the camera at times, her eyes were frequently tearful.
so do you think that pulsatilla will cure her mentals as well?
I think pulsatilla could do a lot to help this kid.
Yeah.
And pulsatilla does come up for rage.
Yes, it does.
I think one could make this out quite nicely through pulsatilla.
Well, I gave her pulsatilla.
There was the past medical history of ear infections.
Well, actually, that was the older sister. That was a very badly edited piece of tape. This girl has had recurrent infections and so on, which suggests what is the chronic remedy for pulsatilla? What's the chronic? Sorry? Silica. So, I mean, we may well be looking, in some months' time, at talking about looking at silica if she's having recurrent infections. Sure. And that's a very, very, very valid point. But at this stage, the main thing is that this girl has got a chest infection. She is physically unwell, and all the mentals that we're seeing are, in some respects, part of her constitution, but also a reactive state secondary to her physical illness. And she's not usually like this. So, we give her pulsatilla. This interview is nearly finished, you'll be glad to hear, and we'll just wind it to its end.
Thirsty with this.
So she's not much thirst, is the question.
Would you say she's less thirsty than you'd actually expect?
Yes.
Right.
Just very wheezy with it as well.
Right. And it tends to be worse if she's lying on her back.
Yes.
Dread. Does it tend to be worse on one side than the other? Do you notice any asymmetry in it, or is it just great?
She's not usually
What am I thinking of here when I ask about the asymmetry of the redness of the face? I'm thinking of Camomilla here. Yes, it does. Pulsatilla does too. Yeah. And I'm thinking, I'm still at this point in the interview, I'm still weighing up between chamomile and pulsatilla myself. I'm sitting there with the materia, medica and my repertory, and I'm going, I'm still thinking about it, although in retrospect it's all very easy, but at the time it's not necessarily easy. Right. What did I ask in terms of follow-up for this child? I saw her last thing on a Friday night. She was my last patient on a Friday night. What did I say in terms of follow-up for an acute remedy? What kind of...
What did you give her? More or less.
I think I gave her 2 12s and a 30. Split dose between 2 12s and a 30, probably.
May I get them to phone me on Monday morning?
Yeah, that's what I did. I got her to phone me on Monday morning. Because by then, if the remedy's right, she'll be better. Absolutely no... And so she phoned, and this is the phone conversation.
If anything doesn't go her way, she's absolutely screaming blue murder. Her sleeping pattern has improved 100%. She's sleeping well at night time, and there is no hint of a cough. But when she's getting up in the morning, she's constantly clearing her throat, and she does have a wheeze.
Right.
She seems to still have a kind of head cold. If she sounds a bit congested, even when she's speaking.
Right. Do you think she's become more irritable than she was when I saw her at the clinic?
No, I wouldn't say she was more. She's probably still on a par.
Similar to that?
Yes,
What about her colour?
Her colour has improved. Well, it's gone back to normal, except when she goes into a tantrum, and the redness is appearing again, and it's going very blotchy.
And it's blotchy redness, and
yes.
is there redness, and
yes.
is there a particular area where the redness is particularly noticeable?
It's the left-hand side.
The left-hand side.
Yes.
So she's flushed on one side of the face.
Yes.
Right. Okay. What about discharge from her nose?
There's nothing as yet. She's blowing her nose a little, but it's clear.
Right.
There isn't really a discharge, which makes me think, there's still a lot there, because it doesn't seem to be coming through.
Right. So there hasn't been any increase in the discharge since we saw you?
No.
No. Okay. What about fever as such? Is there any fever?
Not really. No, I wouldn't say she was terribly feverish.
And is she irritable all the time, or is it coming and going?
It's coming and going. I mean, she got up this morning and she didn't want her hair a certain way, and that set her off. I collected her from nursery. Something didn't go right. She couldn't find a toy. That set her off. I got her out of the car there. We've just been for the school run. She didn't want her coat off, and that set her off. It's silly wee things, and she's really going into a terrible state.
And is it tears? Are tears flowing?
Yes.
Right. Okay. So, some things have changed. What about the wheeze? Is that there all the time, or is it coming and going?
No, the wheeze, I would say, is more prominent when I just get her up in the morning.
Right.
Certainly, I'm not noticing it when I go in at night. She's very, very peaceful.
Right. Was shortly after the remedies, did it produce a reaction in her at all?
Well, Saturday afternoon was a terrible afternoon with her. She just cried all afternoon. We couldn't calm her. She didn't want to sleep. She just didn't know what she wanted.
Okay, to recap, she had an aggravation on the Saturday, and she was inconsolable Saturday afternoon. She's much better at night. She's sleeping throughout the night. The whole modalities have changed. She's no longer worse than lying down, but the wheeze is appearing when she's disturbed and when she's getting up in the morning. The sputum has settled. She's got no fever, but the irritability and all the mentals are there. She's developed redness of one side of the face, and so where do we go from here? Mum says, I say, is she better or worse or whatever? And Mum says, I think she's a little bit better. But in fact, all the chest signs, all the fundamental indices of pathology have actually come down. And what we're left with now are the mentals. We've got a little bit of wheeze on getting up still, but we're essentially, at this point in time, left with the mentals. So what do I do? What about acute? I mean, the essences of acute prescribing and so on. Are the rules the same for acute prescribing as they are for chronic cases, or for?
I think they're called about giving you some chemical now. They're called at all.
I think that it says to change the remedy.
Yeah. That's what I do. I give her Camomilla at this point. In fact, she went away on the Friday with Pulsatilla to take first and Camomilla to take second. And I instructed the mother to wait for another day, just to measure out and see how things are going. And if she's still irritable the next day, to give Camomilla. And unfortunately, all I've got is a letter for follow-up because they didn't feel it was necessary to bring her back. And so I'll just read you her letter, which is a reasonably good account of things. Lucy's health has continued to improve. She had a couple of light colds during this period, she's now on 16th of January, so we're talking about a fortnight, or no, 3 weeks later, or a little more. I left her to her own devices. I'm pleased to say that she overcame the sniffles and coughs by herself without the aid of Calpol or antibiotics. Her behaviour immediately following our last prescription was a bit erratic. She seemed to be crying almost continuously, and as a last resort, at the last visit, yes, and as a last resort on the 29th of December, I gave her 2 of the 3 preparations you gave me. That is actually the second prescription. It's not the last prescription, it was the last visit. This appeared to help, and she seemed to become a little calmer. She is now almost 100% better and more like the child I used to know. I am now able to reason with her, and she has fewer tantrums. Of course, she has now settled back into her normal routine after the Christmas festivities when she seemed to be in a permanent high. To sum up, I would say that her cough has cleared up, she has very little catarrh, her behaviour is much improved, she seems stronger in herself, health-wise and much happier. Finally, I would like to thank you, etc. So she responded clearly to the chamomilla on the basis of her mentals. If we'd given her the chamomilla the first time round, I don't know what would have happened, but I think it wasn't the right way around. All I could say is that the main weight of the case at that point, in spite of the mentals, was that she was physically unwell. We had to deal with that first. And that is a little bit of acute prescribing for you. Would you like to do another case, or shall we...
What about the law of health, about the disappearing of a pathological condition and reappearing or becoming worse, the mental condition? It seems to me this is not a right form of treatment.
This is because there is a difference between the strategies and the way you deal with acute prescriptions than to the chronic case. The acute prescriptions have got to prioritise the main seat of the illness pattern. Sometimes the pathology and all the reactive state will be in such tandem and be so similar that one remedy will clear it and will clear it beautifully. But sometimes there is, even in acute prescribing, the requirement for a number of remedies, sometimes in relatively short succession, sometimes even in the course of one day in the acute of a very dangerous acute condition. You may need to use remedies and short intervals to actually challenge the current state of the illness. You have got to challenge and prioritise the case. If we dealt only with the mentals, we're not doing the child a favour. Sometimes they correspond together, but not always, you know. And there are some people, particularly in Europe, who will be using acute remedies. They'll be using belladonna, followed by calcarea, followed by something else. And they'll be using remedies within short succession to modify the acute illness in severe conditions, you know.
I think in acute condition, vital force is very strongly sensitive to what is happening in pathological terms.
Yes.
So he will respond.
Yes. Yes. That's right. The pathological condition.
That means that the curative law for mentals to physicals is always correct.
Yeah. You see, a lot of the constitutional pictures that we get are people who've been proven on and who've got some kind of background constitution where the changes are slow and all the keynotes and everything we assemble into materia medicas, and they're all black and white and down in tablets of stone, and we get this solid image of a case. But illness is dynamic, and we have to follow the dynamics of the case. And in subacute conditions, you can follow the dynamics of the case based on the constitutional type or the essence or whatever, in the knowledge that if the mentals don't clear first, then you've probably got it wrong. And if this child was essentially a psychiatric problem, if the mentals didn't clear first, then you're given the wrong prescription. If the most fundamental part of the pathology is not being addressed by your remedy, then you've given the wrong remedy. But it's a difficult thing. It's a difficult thing, and I think you have got to do a lot of acute prescribing. General practice is a wonderful place to deal with remedies, and instead of using antibiotics in a chest infection, you should be using the right homeopathic remedy. And there's a body of experience in this country which has been very sadly lost, particularly in children. In Glasgow until the 60s, we had a children's homeopathic hospital. And we had children coming in with acute conditions being treated homeopathically. Chest infections and you name it, you know. And the experience of our previous generation, unfortunately, has not been captured well enough for us to learn from. And we're having to relearn something that should have been passed on to us, I think. I don't know whether you feel that, but...
Well, the Hamish in particular. Well, Hamish was one of the last people to actually do these things, when he was telling us not a child, an adult, actually using ant tart, sitting up all night between before the ball, and giving an ant tart before there were diuretics that worked.
Yes. And there's
nobody wouldn't do it now.
No, I mean there are some very eminent physicians around in Glasgow still coming up. Hector and Alistair McNeill, who both worked within the children's service, and Mary Frame, working within the children's service, whose bread and butter in their early working years was dealing with acutes before there were any wide availability of antibiotics, and treating serious pathology with homeopathic remedies and getting the acutes right. That is not to say that you take any risks with conditions with serious morbidity or mortality, particularly if you're not confident of the remedy. And so you don't play around with acute asthmas or acute chest infections. You don't fiddle with them. But if the remedy is there staring you in the face, then it's legitimate, if you've got a bit of time to play with, to give the remedy, and if you're right, the acute state will completely change its nature, and you can follow that and prescribe accordingly. So that's an acute case. Do you want to do another one?